According to World Health Organization, 1 in every 8 people has a mental problem. Here in Uganda, the challenge mainly affects school-going children, and this challenge has been mainly attributed to waking up very early to attend school.
Young people's mental health needs to be protected. Children go to sleep at 11 p.m. after night prep. They wake up at 2 a.m. to go to class. That is killing our children's mental health. That's not the only school.
And then, with the terrible curriculums that wake them up at 2 or 4 o'clock in the morning, they become very sedated in the day they want to sleep. To keep concentration, they take stimulants. Drug abuse starts. The whole thing goes on and on and on.
The situation is much worse among children below the age of 14. Studies indicate that 50% of the children have a mental problem.
Most of us above 50 here had somebody talk to you about psychology. Your parents are always thereby with you. And many of us below 14 years, the parents are in Dubai.
Personally, I believe it is in 3 things: the school system, the curriculum, and how our families have neglected their responsibility of looking after children. People leave and go abroad thinking that sending money will help children. Children want to be with their parents.
We are finding people are suffering within workplaces. They don't have enough rest. They have a lot of anger. People are being shouted at. People are being abused in their workplaces. They're not being appreciated. There are no work policies that are promoting mental health. So we are seeing the mental health state going down in the country.
Subsequently, these effects are reported in the older people.
Come to parliament at noon, you will get more than 20 members of parliament talking to themselves, which is a sign of depression.
To curb the problem, government through the Ministry of Health has today unveiled a 5-year plan which will help create awareness about the disease.
Every district should have a mental health focal person. So we are going to ensure that within the first 3 years of this strategic plan, every district, we have 142, they should all have a mental health person. Secondly, we want to strengthen care. There's care that is happening, but it's not everywhere. We want to ensure that each and every facility can offer mental health services.
The move is deemed timely as the country grapples with the side effects of both COVID-19 and Ebola virus.
It disrupted services. So the few mental health services that we had in Uganda, which are centralized, were literally shut down. And many mental health units, as you recall, in our regional hospitals, were converted into isolation units for COVID-19.
Nearly 14% of Ugandans are reported to have mental health-related problems, which many are not aware of. Ramson Muhire, CTV Pemedition.